don't worry. So interrupting what I just started. Thank you all for being here. Obviously, you're the early arrivals, so we really appreciate everybody coming in today. Dr. Mathew Brown joins us today from Chicago. He specializes there in whole health psychiatry. He has over 10 years of experience working in mental health care and is board certified by the ABPN in both child and adolescent psychiatry and adult psychiatry. Dr. Brown's method is aimed at primarily the treatment of depression and anxiety, as well as other mood disorders and ADHD. He's presented nationally and internationally on topics of attachment theory, child development, and psychedelic medicine. He's the founder of the Psychedelics and the Future Psychiatry Meetup Group in Chicago, and has been published in various peer-reviewed journals as well. He is a member of the American Academy of Child and Adolescent Psychiatry and the American Psychiatric Association. He is the Chief Medical Officer at Trilogy Behavioral Healthcare and a community mental health care center in Chicago. And Dr. Brown is an excellent example of integrating psychedelic science into the practice of psychiatry. So after that very long-winded introduction with lots of accolades, I present to you Dr. Mathew Brown.
Sure. So, all right. So, thank you so much, Margaret. Thank you, all the other organizers, Alex, Victor, Raul. Welcome to the Intercollegiate Summit or Intercollegiate Psychedelics Summit. This is awesome to be able to kick this off. It should be a fun couple of days. We've got some amazing presenters. David Nutt's going to be here tomorrow, which if you've never seen him talk, he's amazing. He's done a lot of awesome research. But to start off today, I guess we're talking about psychedelics in psychiatry. And I guess Margaret's driving things. So before jumping into that subject, though, I did want to comment on this summit. So my understanding is this is very much of a grassroots effort that's started by the students of 3 different colleges here. So we've got Harvard, Princeton, and also UPenn. And you decided to come together because you wanted to learn more about psychedelics. And I was trying to think, okay, how is this relating to the stuff that I've done, and why did they even contact me to come out here? Because honestly, I've not been invited to just present, like giving an invitation to present something like this. And so this is awesome. You can hit next. But I was thinking this is very, very much like what I've been working on in Chicago. So roughly about 3 years ago, I started a meetup group called Psychedelics and the Future of Psychiatry. The way that started was basically when I was in residency training, I was very interested in the subject, and I talked with my co-residents and other fellows when I was in fellowship about psychedelic medicine, and that was fun, but I found that we kind of came to the same conclusion almost every time. And thinking about that, it made me realize that maybe we're coming to the same conclusion because we're all coming at it from like the same perspective. Again, we're all psychiatrists, right? So after training, I didn't really have that outlet to be able to talk with folks, and I was like, well, how can I do this? And I was familiar with Meetup. I'd gone to a few. That's a great way to meet people once you're an adult. Because outside of college, like after this, it gets really hard to make friends. But let's be honest. So I set this up, and I really thought it was just going to be me and like 5 friends hanging out at a coffee shop. But 3 years later, we've got over like 1,300 members, and we're full every single month. And the concept, though, is that besides just getting psychiatrists in the room talking about this stuff, it's the study of psychedelics is really the study of consciousness. And every human being has a slightly different experience of what it is to be conscious. And so the only way that we're going to fully understand like what consciousness is to get all the various different perspectives from the different walks of life of what it is to be a conscious human, to be able to get this whole holistic view of what's going on. And so that's what we've been doing there. And I think that this summit, again, is sort of a representation of something like that, and it's fantastic. So moving forward, so what is psychedelic psychiatry? I don't know, but I'm asked to talk about it, so I've got some ideas. I've got a picture of a glacier here, so the concept is that we're only going to be able to barely scratch the surface. We've got like maybe about an hour to talk about this. I've got maybe 1 or 2 points that are maybe salient, but let's just recognize that there's like lots and lots underneath that I'm not going to cover, that hopefully some of our other speakers are going to talk about, but we'll try. Moving on. So, and throughout this, as far as my framework of going into it, what do I think is the crux of psychedelic medicine, especially when it comes to psychiatry, and then also like the body as a whole, is always remembering the F word, next, and that F word being flexibility. Right? So the concept is that, and I'll go into this a little bit more in just a second, but as we experience life, we tend to do things the same way over and over again. And sometimes our thought structures become very, very rigid because we've had the same experience over and over again. And that rigidity causes conflict. And if we can get to a place where we can have a little bit more flexibility in thought, that can help some of our ideas flow a little bit more freely, and so we don't get stuck in the negative thought loops that we tend to get stuck in. Moving on. And so, and who is this? So this is my son Miles. There's a point for this. So he'll be 8 weeks old on Sunday. Besides looking cute, the reason why I decided to put him on here is that I think that this is another example of like a human trying to experience the world for the first time. Because like right after he was born, he came out and I was holding him while his mom was being tended to, and you can tell that it's not like the Freudian concept of the complete blank slate. There was something there. There's a connection, and it's really been a very interesting process, literally day by day, kind of seeing how he grows and develops and does different things to try to understand like this body that he's in, like this universe that he's now in. As a great example, like moving arms. If anybody's seen really small infants, they have no concept of how to move their arms, and they're like putting them on their face and stuff like that. So anyway, he's developing. You can go next. And so as he's working on this, he's creating a lot of different neuronal connections, right? Because I don't know if the next slide is. No, go back. So he's creating a whole bunch of different new neuronal connections that we're hoping are going to develop and become like a cohesive unit that is very interoperable and utilitarian and move forward. And it looks like something like this. So it's, but really in reality, it probably looks a little bit more like slide that. Meaning like we have like these different thought loops that we end up going through, and then there's not a lot of new connectivity after we kind of get those neuronal linkages made. To drive the point home, so here are some images of just neurons throughout the development of a child. Of course, this is a drawing, so it's not perfect, but if you can see, like as a young infant, they have a few different neurons that are kind of growing out, trying to find connections and make connections with each other. And it's somewhere around the age of about 7, but really it's kind of like this magical time between like say 4 and 9, that there's this dramatic growth of neurons and a whole bunch of new connections. And if any of you have been around a child during that period, you know this is a time where, especially on the younger side, this is where they have like a lot of imaginary friends, and they believe in lots of different ideas that as we as adults might think are kind of silly, but the world is magic and they'll kind of believe everything. Also, I think adults are really cool then, so they're always fun to be around. But as they get older, this neuronal pruning starts to happen. So like the different connections that you have to different areas of the brain, they start to break off because those connections theoretically have been a little bit less than helpful. And also this is trying to make more immediate, reactions to things when they happen. In other words, like what's going on? Is this slide? Yes. So the concept being like the brain is very, very smart, but it is not wise. So what do I mean by that? So the brain learns very, very quickly based upon some sort of a stimulus how the person wants to respond. And the more you get introduced with the same stimulus, the more salient that response is going to be. It's just going to happen over and over and over. Until such time as that response becomes unconscious and you're not even cognitively thinking about what's happening. This is very, very useful, and this is very, very helpful because it's really, really difficult to try to figure out every step in a process every single time you get confronted with some sort of a stimulus. A really good example of this that I like to use in practice is, and this works a little bit better one-on-one, but think of the kind of car that you drive, or maybe the car your friend drives, the car your parents drive. When you're driving around, you notice a lot of that car on the road. Most probably you do, and the reason why you do is because, like, subconsciously, your brain is constantly scanning around for your vehicle. this is very, very helpful so you don't get lost in a parking lot, right? Because say like I drive a gray Honda Civic, you have to be thinking, okay, where's the Civic? Okay, where's the gray Civic? This is a lot of work. Our brain just kind of does this for us automatically, which again, very, very useful. However, the utility of this tends to break down when we start to have less than helpful thought patterns that persist. Okay, and this is maybe why, as people get older, they get kind of stuck in like their modes of thought, and they're like, I don't know, adults have strong opinions that sometimes are really, really hard to change. This is why, because that mode of thought they've been in before has been very, very helpful for them. But the brain is not wise enough to be able to create like the new pathways. Another analogy of this is like literally a pathway. So you have the very, very well-worn road that you're just going to go down every time. And if you want to go down a new path, there's like weeds and stuff all in the way, and you have to like whack down the weeds first, walk on it a few times. Eventually, it becomes a little bit smoother. But this path over here is still very well worn, and so many times you might go down that path when you're wanting to go down this path, and this just takes time to change. So this is a now very popular image from some of the work at Imperial College of London. So what we have here is a picture of the brain under a normal condition, and at the top this is a connectogram. So the idea is like the different areas of color and where they're connected. This is just how the brain is working in the normal waking state. Then over to the other side we have the brain under the influence of psychedelics. I can't recall, this was psilocybin I think, right? It was psilocybin or LSD, I'm pretty sure it was psilocybin. So as you can see, there's all kinds of new connections happening then, right? And with these new connections are also stimulates new neuronal growth, so that during this time period, some of those new connections might actually stick. And so it's very, very important that if you are engaged in any kind of psychedelic activity, that you want to take advantage of this like hyperplastic state and these new potential connections that are going on, because this is still sort of kind of happening for a little bit of time, even after any kind of substance or whatever experience, even if it's not substance mediated, is done. Like it'll still stick around for a little bit. So during that time, you want to kind of engage in different therapy and try to do positive things so that you can make new positive connections. It's also important that maybe you try to stay away from less than helpful habits, because those less than helpful habits might be able to form even a little bit more easily if you're engaging those at that time as well. Moving on, I think. So yeah. So this is another slide from I think Carhart Harris et al. And they talk about their theory of the entropic brain. This is kind of driving home the point that I was talking about before as far as like rigidity. Or another way you can kind of think of this is like inflammation, because I think that that's also fairly comparable. And the argument up here is that as thoughts become more organized and rigid and strict, you kind of get stuck in little thought loops. So somebody with OCD, they're constantly on the lookout for germs, and they're thinking they're crawling over their hands. They need to wash their hands all the time. They need to take a shower. This is very, very maladaptive. And then we get to the other side, which is the much more, the less, the more entropy, so the more variability that we can have in the system that allows for more flexibility of thought and a different perspective on the situation. But he doesn't really talk about how, or at least this image doesn't really show that it's important that we want to stay somewhat within this range, but not necessarily get out of it. Because again, with flexibility, there's this element of elasticity. It's not just complete laxness. So if you were to kind of get on the very, very loose side of things, and then the whole thing kind of breaks and falls apart, this is where you're maybe stuck in a different state of reality than maybe the rest of us, something to like akin to like schizophrenia or something like that. But we kind of like need to rein back in so that we can get into this more elastic, flexible state. Yeah, go ahead. So how do we cultivate flexibility? But really, like, so what is happening? Like, or how are we understanding that like different healing processes are in place? So one central concept to psychedelic medicine, and honestly, I'm a DO, so this I feel like is just true of all of medicine, is that the body has the ability to heal itself as long as you put it back into position to be able to kind of like do the things that it needs to do. So in osteopathic medicine, so we have to learn all the things that like regular MDs have to learn, but we also have to learn about like structure, function of the body, a lot of nutrition stuff. We do some both intensive massage with some slight manipulations. So what can tend to happen is when you have a restriction, perhaps in your spine and something like that, not just your vertebrae is out of place, but that's kind of putting pressure on like the nerve, any kind of like arteries, vein, anything that's going through that area, and that's going to just restrict the flow of the system, right? And so if you decrease that constriction and you allow for a free flow to happen again, the system works a little bit better, and then it can kind of work to help repair itself. A similar analogy is sort of like in wound healing. This is something else that they use as an example when they're talking about like the psychedelic like inner healer all the time. So you get a cut, as long as it's clean, it's going to start to heal from the inside, and eventually you're going to have a nice new coat of skin, or maybe a little bit of scar on the surface, but it's going to just kind of heal itself. You don't have to do anything to it. And so the psychedelic psychiatry, I would argue, functions in a similar manner. So it's not like the practitioner is forcing or doing anything. It's just kind of allowing a place and trying to help create cognitive structures to allow for the more easy expression of thought, rather than allowing those thoughts to become constricted. And besides thinking about let's see. Go ahead. Yes. Okay. Good. What exactly are we aligning? So again, back to the basics of medicine. Back in medical school, they taught that human is body, mind, and spirit. And so in medical school, we learned a whole lot about the body. We're going to learn a little bit about the mind. And then when it comes to spirit, they said, well, that's important too, but really that's the realm of religion, and just kind of like let them deal with that. Which I always thought was a little bit odd, especially because they brought it up saying it's very important, and they're like, yeah, but it's really not that important. Let's just focus on the other stuff. But really, psychedelics, it's very interesting that I think this is sort of like the marriage of all three, because there's this very, very distinct spiritual aspect to both the psychedelic experience. I mean, that is one of the core features of it, is that you feel like you maybe had some sort of a mystical experience, or have like oneness with the universe, or connect with whatever God is, or you define as God. And so if you look at any one of these layers, if we kind of realign them, it allows it to flow better and will inform each layer below and above. So I think I put the quote here, it's like turtles all the way down. I don't know if anybody's heard the creation story of like maybe the entire universe is on the back of the turtle, and then the question is, okay, well, what's the turtle sitting on the back? And it's like, well, it's just turtles all the way down. And so this works both ways. In medicine, in physics, spiritually, it's kind of all the same. Right, so if I'm going to make an effect on the physical body, then that's probably going to work on the cells underneath, and then the atoms and all that kind of stuff. But also, when I'm healing myself, and I'm interacting more effectively with the outside world, that's going to create a little bit of a form of healing, not just necessarily within myself, but within my relationships in my community at large. I'm not going to necessarily get into that too much, but that is a very important piece. Because that does inform, especially, how one might engage with a patient in psychiatry. So the connection with the client is really, really important, and probably one of the most important things when you're engaging in therapy with somebody else. What is that connection? I don't know. It's anybody that do we have any therapists or psychologists or anything like that in here, Richard? So. Okay, so a couple. But there's definitely this sensation or feeling that you get in the room when somebody comes in and you're going to start to interact with them. I used to call it my spidey senses, I still do. But I think it's more than that. It's like you start to, as you interact with people, kind of just pick up on just, I don't know, the vibration or whatever that they're putting into the space. Next slide. And this is a logo of a friend of mine. He's also a psychiatrist in Chicago. His name is Dr. Naqshbandi. But he coined this term that I really liked. He called it empathic resonance. So in other words, that feeling that you're getting that is being projected by that other person, if you can pick up on that, and that other person can pick up on the fact that you're kind of vibing with them, there's this resonance of the empathy between the two of you in just that process of sitting there with the other person and allowing them to express their feelings, and them feeling that you are listening and being part of that process allows, again, for the processing and flow of their thought structure so that they can sort of, again, realign them and kind of create more helpful thought structures. Yeah, so what is this? So this, again, this is a chart from cognitive behavioral therapy world of unhelpful thinking styles. This is very, very practical, but I think that it's useful in this realm as well. So like the concept here that relates to this is being able to kind of step outside of yourself and realize that we have these unhelpful patterns, and recognize when we're about to go down that less than helpful pathway and try to help ourselves go down the more useful pathway. And of these quote-unquote unhelpful thinking styles, I would argue that the key to being able to get into this more mindful state, or at least allow yourself to be there without getting too frustrated about it, is focusing both on this concept of overgeneralization and also like the shoulds and musts. So any of the absolute terminology. The reason for this, next slide, and this isn't a perfect example, but it goes with my analogy a little bit. So if you think about thoughts in the brain, they're kind of floating around on like little roads, so to speak. And if you have an absolute thought, like this must happen, it has to happen, if it doesn't happen, like this is wrong, this is bad. And then you have a thought that conflicts with that, right? I mean, so you kind of built this wall. You have a conflicting thought that's going to run right into that wall. It's going to cause a lot of conflict. So it's going to cause anxiety, depression, anger, a lot of frustration. If you can allow yourself to have a little bit more flexibility of thought and not relying on these absolutes, this rigid structure, and really truly saying to yourself, well, maybe this might happen and I hope that it would, and that would be most helpful. Or if it doesn't happen, that would be very unhelpful. But still, there's a little bit of a barrier there, but that's much, much easier to get through, and then your thoughts can kind of flow a little bit better. So, moving on. So, another concept in psychedelic medicine, just again, all medicine, all psychiatry in general, this idea of building compassion. But compassion for yourself and for others. And keeping in mind that this compassion and love is indeed the answer. This is one of the other teachings that psychedelics tend to bring back, or tend to give us. If you talk to almost anyone who's had a psychedelic experience, they tend to come back saying like, oh, love. It's all about love. And it is. But it's very, very important to love yourself. Be compassionate towards yourself how you might be compassionate to someone else. So this is kind of the opposite of like the golden rule, like treating other people how you want to be treated. It's more of like treat yourself how you would want other people to be treating you first, which generally is much more compassionate than we treat ourselves to begin with, because normally we are our own worst critics and we're harder on ourselves than anyone else. And then once you can get to that place where you can be compassionate with yourself, it's much, much easier to be able to be compassionate with other people and just be nice and cultivate more positive relationships. And that is really a huge key to healing. So getting back to psychedelics specifically, and so how are we cultivating these other like non-ordinary states and creating like these new neuronal growth and ability to kind of make new connections, all that kind of stuff. So this is an image of, I believe, one of the psilocybin sessions. This is either Hopkins or NYU. Does anybody know? I can't remember. I just pulled off the next one. So we got two. Hopkins. It is Hopkins. Yeah, this is the Hopkins Research Lab. So we've got two co-therapists sitting, and then the patient is on the couch with an eye mask on, headphones, having their own internal experience. This is very, very helpful, and this is what we're doing right now. The same setup is being shown to be helpful even with ketamine, which is available to be used in clinical practice right now. I have one patient I'm putting through a ketamine protocol at the moment, but she's in test case at the moment. I'm hoping to do more of that, and I'm also very, very eager to be able to utilize MDMA and psilocybin in the next few years once they become rescheduled. But as helpful as this is, we've got to keep in mind that these extreme, like non-ordinary states of consciousness can go from that extreme, but really non-ordinary states are actually quite ordinary. We have them all the time. Dreaming, Driving a car, I don't know how many of you have ever had the experience of like you get to work and you can't remember how you got there, and you just kind of blanked out at that time. Well, you were probably in a trance-like state, and you're brain was someplace else, right? There's a slight dissociation there. Associate all the time. Next slide. So other things like watching a movie with friends or even reading a book. You kind of get outside of your own head and you can kind of get into the space of somebody else and experience their existence for just a moment. Moving on. Or even like a concert. And I know that oftentimes there's some substance use at concerts, but even if you go in stone cold sober, there's this feeling that you get when you're with this crowd of people, and there's all this music going on, and everyone's kind of connected. You feel differently, and something else is happening. And so besides just focusing on all of these extreme non-ordinary states that are driven by psychedelic substances, know that we have this ability to go into non-ordinary states ourselves. And not only that, we have the ability to cultivate fully psychedelic states. So you don't need a psychedelic to have a psychedelic experience. Intense meditation can kind of bring you there. Next slide. Sensory deprivation tanks. Next slide. Or even breath work, which is another form of meditation. Now breath work, holotropic breath work, or just different breathing meditation, this is what I'm perhaps most interested in personally, as I've found this as potent, if not, well actually I've had much more intensive experiences just with breathing and music and being around other people than I've had ingesting substances. I have gone to some other place, I don't know where it is, that I've kind of brought back, and that's with no drugs whatsoever. And I think this is a very, very underutilized technique, and also a very, very under-researched technique that we have. And this is a huge opportunity for anybody who's interested in this kind of stuff to try to figure out, like, well, how is this working? I have my own theories. I'm not going to go into all of them right here, right now, but this is huge. But if you think about what's going on here, we're adding together a number of different things. So we have intensive meditation. We have music, sound, vibration. So that vibratory sense starts to, like, really, the music is generally loud. So the really loud music vibrations, they do like jostle your fascia, like your smooth muscle tissue, like your skeletal muscles, and also there's an element of body work. So there's facilitators that are going to be going around the room, and like if you have a constriction or something like that, they might push on your back, and you'll feel this loosening of your physical musculature, and then just like releases of something that you know. And so this is kind of a modality that's bringing together lots of other ways of creating flow of the structure all together in one place. So what is the future of psychedelic psychiatry? So again, right now we're really wanting to get to a place where we can utilize some of these medicines to help with healing on a one-on-one basis. But really, this is in some cultures they do that. But this is kind of novel and probably maybe an artifact of like the research experience and the restrictions on it. But this is I think this is a picture from an underground psychedelic session in I think Switzerland. And if you notice, there's lots of people in the room. There's theoretically maybe a couple of different facilitators there who are not under the influence of a substance, who are just monitoring to make sure everyone's doing okay. So this is really where I hope that we get to. So I think that we want to start with the individual, but after they get comfortable being in these extreme non-ordinary states, allowing them to be in that place with other people around. Because there's lots and lots of benefits to that. And hopefully through the points that I was making earlier, you can see how this might be. Because like if you're going through an experience with somebody else, and that other person realizes that you're there and you're having this shared experience, it makes the experience more, I don't know, more enjoyable, and you can like share it more. Also, it's more economical. I mean, we do not have enough just therapists to do one individual therapy with everybody in this country that needs some help and healing. So, just time-wise, that's helpful. Cost-wise, this is more useful. Moving on. And also, this is like, in other cultural settings, this is kind of how it's done. So this is like an ayahuasca ceremony. Next slide. We got a peyote mushroom ceremony, a peyote ceremony, Native American church, cactus. So these are all done in the group context, so that you can have that like connection with your group. So yeah. So what is psychedelic psychiatry? I mean, these are the main points that I was trying to make here, and I want to make sure we have time for questions. I don't know how fast I sped through all this, and also if we have extra time, maybe we can do some breathing because it would be fun to do some experiential one. But the concept being the body has the ability to heal itself. These non-ordinary states, which again, Dr. Stan Groff, who is a prominent psychedelic researcher, coined the term holotropic states, meaning like trending towards healing. And they help to provide a new perspective so that you don't have to get stuck in the same thought process that you're in all the time over and over again. Feeling of non-duality, again, like that me being able to connect with you, and actually, I mean, we didn't really talk about this, but this is another teaching that psychedelic medicine tends to give us, is that we really are all kind of one thing. So meaning like I'm not just me and you're not just you, we're kind of in this together. Not only are we in this together as a community, we're in this together as all of nature, as in like all of the earth, as in all of the universe, just kind of navigating in what this space-time continuum that we're in. But really we're all sort of connected in this construction. And so creating a balance, how have I created balance in my own practice? So I split my time work-wise, working both for Trilogy Behavioral Health, which is a community mental health center where we deal with some of the, actually I was talking with a colleague, I guess we deal with some of the sickest individuals in the country. Because we help folks with severe mental illness in Chicago that have zero resources, like Medicaid, no insurance, but not only that, people with a lot of physical comorbidities as well. We're one of the largest providers trying to get people out of nursing homes to be able to get them to live back in the community. So really trying to help just people in that respect. And then I also have my private practice, which is psych arts, but where I meet individually with clients that have a little bit more means to be able to go a little bit deeper, because again, I'm doing mostly administrative work in the other place, trying to utilize resources. Yeah. And so how did I get here? Oh, yeah. Okay. Well, I wanted to have a little bit of time for question and answer. I'll go through my stuff very, very quickly, as Margaret asked. So I mean, I started my path at Indiana University as an undergrad. I started off as a computer science major because I did coding like all throughout high school and elementary school. And I took my first coding class, which was in a language called Scheme. I don't know if you have any coders in here, if anybody's familiar with Scheme. But it was the most backward language that I've ever coded in, and I hated it, and I hated the class, and I decided I didn't want to do computer science anymore. And so I was trying to find classes that would be more fun, so I ended up majoring in psychology and also film studies. While at Indiana University, I did some research, both in alcohol as well as like alcohol and sexual risk-taking behaviors at the Kinsey Institute. But then I stumbled onto the child development lab there and kind of fell in love with working with kids and watching them grow and learn, and I thought that was much more interesting than focusing on all this drugs and vice stuff. At least that's how I was conceptualizing it at the time. So then my senior year, I had this critical decision to make. It's like, what do I want to do with my life? And I thought, okay, well, if I want to do the film thing, because again, like that was the other side of things I was doing. I could move to LA, try to get into industry. It's kind of a risk where I could go to graduate school and become like a therapist. And then I thought, well, drugs are important. I want to be able to do that. So I decided, like, okay, let's go to medical school. So I hung around for an extra year, did pre-med classes, then I ended up going to medical school. Went to Kansas City University of Medicine and Biosciences. Again, this is an osteopathic program, so had to learn a lot there. And really, that's where it was really driven home, this concept. The body has the ability to heal itself. You just got to kind of put it back in position to allow the natural healing abilities to take place. Going on to UMKC, where I did my adult residency training, I was very, very fortunate to be able to have some fantastic preceptors there who were very supportive of me. Because during my time there, there's a 4-month stint, our second year, when we had to cover the emergency department. Like, we had a special psychiatric emergency department, and the residents would run that all at nighttime. So for 4 months, we were on kind of like opposite schedules. So it's like living like a vampire. And didn't have a lot of human interaction outside of the emergency department. So I started listening to a lot of podcasts. And I was listening to one day, and they brought up this thing, ayahuasca. And they were talking about how this is used as a traditional healing method down in South America, and it's very useful for a lot of mental health illnesses and all this kind of stuff. And I thought, this is very bizarre, how I never heard of something like this, and I thought I've heard about everything. It's psychiatry, for God's sakes. Then later on that same week, I walked into one of my attendings' offices, and I made a comment about a painting he had on the wall. They said, "Oh, you like that painting? That painting's of an ayahuasca vision. Have you ever heard of ayahuasca?" And I thought, this is very, very bizarre. And he goes on to tell me all about how he's originally from Peru, and one of his dreams is trying to marry the traditional healing practices of his native people with traditional Western medicine. And I thought that was just crazy that I heard about this thing twice in 1 week. And so down the rabbit hole I went, and I'm not really coming back out from there. Went to the University of Chicago for my Child and Adolescent Fellowship. Met with a lot of great teachers there. Dr. Khalid Afzal, he's the one who hammered into my head that concept of flexibility, which is really one of the most utilitarian concepts that you can have in all of psychological or psychiatric thought. And then finally, some of my own work with like plant medicine, so just reading a lot, and reflecting on both my experiences and stuff that I've read. So that's kind of my story. And so now this is, I guess, question time. So what questions might anybody have? We'll start here and we'll move towards that.
So first, you have some of your talk, and I really like your project as well. But so last summer I was in India, and the kind of a remote place that Steve Jobs was in for a year, and the yogi that he met there, I went to that place because I was interested, and apparently that yogi tried acid, like tried LSD, and it just did not affect him at all. So is that like psychologically possible, and could it be possible that you could be in such a state that like your psychedelic changes your ability?
Yeah, so I think like Ram Dass is talking about this like quite a bit. Yeah, right. So theoretically, yeah, because I mean, if you're cultivating that spiritual side of your being, or being able to connect with that part of your brain that taps into the feeling of mystical experiences, and you're able to access that at any time, and maybe you're partially living in that state as if you're like meditating a lot, what's left for the substance to do? Because again, the substances really aren't creating the state. The substances are a catalyst to bring your brain into a place where you're just doing the thing your brains do. Because if you take like LSD, for instance, it's only in your system, or perceptively in your system, for a very, very short amount of time. So the experience lasts hours later than when you have any perceivable amount of drug in your system. So it's not the drug the drug is mediating the experience. Again, it's the catalyst for the natural human ability to get there, but it's not really the drug that's creating the experience. Theoretically, yes. Yeah, so that's what I'm saying. You don't actually need psychedelics to have psychedelics.
Thanks for your talk. That's what Mike sounds. One of the questions that I have is about actually using psychedelics in practice for patients with psychiatric disorders or depression. As you said, a lot of these patients go through the same type of loop-like thought processes. How can we control these patients from not going back into those loop-like thought processes and having a more flexible thought process in this realm instead of trying to like find their way outside of it?
What do you mean find their way?
Like for instance, keep going in their like loop-like thought processes, but kind of stay in that place while having psychedelics. For example, maybe going down like a bad trip.
So, all right, so let's talk about bad trips. because there's this concept of a bad trip, which sometimes, yes, everything is bad, so this is really going back to set and setting, right? So, set meaning like what are you bringing to the experience yourself? What is in your system? Setting, where are you? Who else is around? What's going on? If these things are very, very misaligned, and particularly if the setting is very poor, there could be a very negative outcome, especially if you have a guy that's less than helpful and has some nefarious intent. However, if you're in a very safe environment that's promoting healing, and you still have what some people might consider a bad trip, oftentimes these are the abilities for, these are considered more like challenging experiences and abilities for healing and growth. Because oftentimes the things that come up with a bad trip are the processing out of all of those emotions and fears that we're holding inside of us that aren't able to be expressed. And many times when somebody has a really profound experience that they feel is very negative at the time, retrospectively they feel like that is maybe some of the best experience they've had afterwards, because they feel this literally weight off their chest or off their back, that they don't have to worry about it anymore, because those thoughts have now all been processed out. And so that is the concept really of the anxiety and depression. So we're kind of holding in. Again, it's like when you have emotions, you're bottling them up, you're pushing them down, pushing them down, pushing them down. Like your emotions are your body's way of communicating with itself. And your emotions will be heard, whether you like it or not. And you can bottle them up for a time, but eventually they're going to bottle them up so much, eventually the top is going to pop off and everything's going to be spewing out all over the place, and it's not going to be a pleasant experience. But afterwards, once you kind of get it out, it's a lot easier to not necessarily pack stuff back in. So oftentimes people do experience a sense of relief that may be prolonged, but so we say with psilocybin, after having an intensive psilocybin experience and also some subsequent integration therapy, it's not uncommon after one time to be able to have relief for somewhere between 3 and 6 months. Now after that you might start to trend a little bit back towards like where you were before, but then maybe you just need another small booster session, like maybe once or twice a year. But this is not like taking a pill every day, which is kind of the trap that we get stuck in. Okay, all right, great. Did that answer your question at all? Or
I think so.
Okay, all right.
So kind of going on what you were just saying about we don't want to take a pill every day.
Yeah.
How do you feel about microdosing and that whole way that you can microdose LSD every couple days and have increased connectivity and workflow?
Right. So this is another thing that's an area of study that I think is greatly needed because we have very minimal studies so far. We have lots of what we call anecdotal evidence, so people talking about their experiences, but we don't have any formalized published research as of yet. But this functions in somewhat the same way. Because one thing that is true, even though theoretically with microdosing you're taking such a small dose there's no perceivable effect going on of the substance, it's not necessarily uncommon, especially for slightly more activating substances like LSD, to create a certain amount of anxiety and discomfort every once in a while. I know that a lot of people popularize say I took the microdose and everything's perfect today. That might happen, but oftentimes if you're looking at more of the research, it's like maybe the day after is sometimes better than the day up. And those things and that discomfort that's coming up during the time when you've ingested the substance, that's you working out these subconscious things that you haven't addressed. And even microdosing is not supposed to be a thing forever. And in fact, most of the protocols, or at least the Batman protocol, theoretically you're doing this for maybe about a month or two, and then most people taper off, and then they're not taking the microdose after that. So it functions the same. There's something in the back, and there's a... He's got it.
Great talk. I know earlier before you were discussing how taking psychedelics increase the neural connections after ingestion or whatever it means you take them. And of course, there's a whole bunch of different substances you can take. Do those substances have different, kinetics or so what would be the difference between LSD or MDMA MDMA or all these hosts are on that, do they lead to the same increased neural connection, or is the difference kind of just how long that connection is, or the kinetics, or what is the difference? Do they all lead to the same kind of results? Or if not, or if so, what will be the difference between, I guess, all of them in general?
Sure. So there was a really awesome article in Cell published last year that addresses this, and I'm not going to go into it today in great detail, but like very generally speaking. So the typical psychedelics tend to work in one way through a certain pathway, and it's not that so in the connectome they're making new connections, but really what we're talking about is stimulating new neuronal growth. And so during the time just afterwards, it's what's called a hyperplastic state, because you have the ability to make new physical changes in the brain to make new connections. And most of the traditional psychedelics work through one pathway that is largely the same for LSD, DMT, and psilocybin. Ketamine was also looked at there, which the end result is largely similar, but the pathway that it goes through is different. But I don't know if I want to go into like mTOR, and I don't. Okay, so without having the article here for reference, I'll be perfectly honest, I don't have it memorized, and so I don't want to give you any incorrect information. But if you look through, like, if you look at the Cell article, it's just like neurogenesis, psychedelics, it's free and available. It's kind of it's a heady article.
Hi.
Oh, we're not. Where's the mic?
Hi, thanks for your talk. I appreciate your perspective. I am a DO student myself, and I have an interest in psychiatry. So I personally am curious about what the reaction you've gotten from the rest of the medical community in terms of all this stuff. Like, do you feel like there's been a lot of pushback? Do you think there's a lot of people saying this is all nonsense? Stuff like that.
So in the realm of the psychiatric community, almost none. No, I mean, like, everybody's been really open to the idea that I brought it up to. Anyway, again, I think that maybe my experience was a little bit unique because I know I've talked to a few other residents who've been in different programs that maybe are a little bit more conservative. Even giving talks and stuff like that, like in psychiatric conferences, people are really interested in this. And I think the reason why is the psychiatrists were very, very used to, giving drugs to make people feel differently. And some of those drugs make people feel good, and some of those drugs make people feel not good. But our goal is to make people feel good with the drugs we give them, right? Whereas my understanding is that my psychologist colleagues, they've gotten tons and tons of pushback. And I think the reason there is they're in the paradigm of we don't use drugs. We don't need that. We need to just kind of like talk and figure it out, and that'll promote the healing. But so no, like as far as like in psychiatry, I think that this is like the ideal for psychiatry because it really is the marriage of both psychotherapy and the medication together doing the healing. Because this is what we didn't talk about. So like for instance, ketamine. The research we have in ketamine right now, there's a lot of ketamine clinics where you just kind of go in, you get an IV, and you're like flipping through a magazine, watching 45 minutes of TV, and they say go home, right? The people report getting relief for maybe about 2 weeks, up to about 2 weeks in that kind of treatment setting. However, when you pair the ketamine with psychotherapy, like in between, and you have like maybe about 3 or 4 sessions plus some lower dose of ketamine at home, you can have, again, the very similar like 3 to 6 months worth of relief without having to give more of that drug. So I'm sorry, I'm spinning off into a slightly different area, but no, I haven't gotten any personal pushback from this whatsoever. Everyone's been very supportive, and all of my psychiatrist colleagues are, they're interested in what's happening with MDMA and psilocybin. Some of them are very excited because they want to be able to utilize it. Some of them are very nervous and they don't know where to start, and they're just kind of starting to read. But I think that people are catching on that we need to learn about this stuff because we're going to be able to prescribe it in like 3 to 5 years, most likely. I mean, if research is going on this way.
So, actually.
Hi.
Hi.
So this is actually a perfect transition. Talking about sort of the professional landscape surrounding psychedelic medicine therapy. I'm currently a psychology grad student, making some decisions about what kind of post-master's program to go into. And I'm wondering what your perspective is, sort of besides the pushback side, of what a professional ecosystem of therapeutic work with psychedelics would look like when it comes to sort of what the balance of work is between what psychiatrists do, what clinical psychologists do, what counselors and social workers do, what research psychologists do, just because the path is still very indeterminate, but as a psychiatrist already getting your hands dirty in this field, I'd be really curious to hear what your perspective is.
Okay, so I mean, the three different modalities of treatment really you're talking about, there's psychiatry, which is going to be something involving like medication. There's psychology where in most states would just be the talking and processing, but some other states that there is an ability to prescribe now, which has its pluses and minuses. And then also there's research. So I'm going to just focus on like the clinical practice rather than the research, because again, like no matter what field you're in, I mean, this is just, there's tons and tons of options for research, and like you can go in any thousands of directions with this. But as far as like the dynamic between psychiatrists and therapists, like out in the field of clinical practice, the way I'm seeing it really start now is very much like, if we go back to kind of what we're doing with these kind of treatment settings, where probably one of the individuals in the room would be the psychiatrist, one would be the therapist, and then going after this, we've got the ability either to meet with the psychiatrist to do therapy ongoing, or perhaps to meet with the therapist, because again, in between the dosing sessions, you want to do some good amount of integration. So therapists are a lot less costly than physicians. Right? So the optimal would be kind of creating like a treatment team where you've got like a doctor on board to be able to monitor like the vital signs, et cetera, to make sure that nothing bad is happening during the experience. Because again, these medications are extremely safe, but there's a few things you want to take, you want to watch for. The serotonin syndrome, there's some stuff with high blood pressure, et cetera. But yeah, so you're working together with the same patient, but they're doing a lot of the processing therapy. The psychiatrist is really doing the medication management thing. Kind of, again, like normal clinical practice is now, but this is just maybe you're collaborating a little bit more. So not very different. But then in a group environment, you'd probably have one psychiatrist there, again, monitoring, making sure everyone's safe physically, and also helping to facilitate the process. But then the therapists are also going to be there facilitating the process with multiple people there in the room. So this seems very novel, but really it's not. I mean, it's still the basic structure of what like mental health treatment is. Thank you so much. What other questions do we have? I know we're running short.
Thank you, everybody. We actually don't have time for more questions for this talk.
Well, hit me up sometime. I'll be here all day and half the day tomorrow. So if anybody has questions, please feel come on. I also have cards, so this is how you can get a hold of me. And if anybody is about to graduate, wants a job doing some community mental health work, helping some really sick people, we're actively hiring a trilogy all the time. So if you want to do some that's all.
Thank you.
Another round of applause for Dr. Brown.
All right, guys. So up next, we have Dr. Jonathan Moreno. He joins us today from the Department of Medical Ethics and Health Policy here at UPenn. However, he is also a professor in the Department of History and Sociology of Science and the Department of Philosophy. He's a Penn Integrates Knowledge University professor, an honor for professors who thrive at the intersection of multiple disciplines, and a David and Lynn Sylvan Chip. Outside of the university, he's an elected member of the National Academy of Medicine and the author of several books on national security, science, and ethics. He also served as a senior staff member for 3 presidential advisory commissions and is a member of the UNESCO International Bioethics Committee. With that being said, Dr. Moreno is the ideal candidate to speak to us today about the history of psychedelics and how it ties into the bioethics and social movements of the 20th century. So thank you for being here today, Dr. Moreno.
Thank you.
Thank you, Victor. It's a pleasure to be with you and to have somebody who's me knows how to pronounce my name. I'm actually even more of an ideal candidate to talk about this than you. A lot of you know the history of psychedelics, but I've got some surprises for you. So, landmark event, which we celebrate, is the approval of esketamine that you know about a couple weeks ago. There's actually a deep head history to ketamine. It runs through the work of a man named John Lilly, who's a psychiatrist and psychoanalyst. Did pioneering work on EEG here at Penn in the 1950s and 60s. He also was involved in deprivation work, and he became most famous in the 1970s and 80s as the dolphin man. He tried to communicate with dolphins. Lilly also, I have a very good authority, was on ketamine for the last few years of his life. But this isn't a talk about Lilly. I want to tell you a little bit about my first LSD experience, which was in 1962. Not what you're thinking. I was 10 years old. You can do the math. My father was a famous psychiatrist. He had a mental hospital, a 20-acre sanitarium in the Hudson Valley, about an hour and a half north of New York City, which is now a hip place. It was not a hip place when I was growing up there. It was a shabby working class post-depression town. Apparently a colleague in New York City asked him if he could use the sanitarium when it was empty. There were too many patients, there were students, for an LSD group therapy weekend. My father himself was not interested in these medications and these drugs, but he said yes. The yellow school bus pulled up, and a whole bunch of people about the age of many people in this room got up. There were a therapy group from Manhattan. I don't know what happened in that weekend, but I know that a young assistant of my dad's, a young psychologist named Henry Tappan, who I'm sure is still alive somewhere, did participate. My father didn't do so bad. I asked my mother many years ago what that weekend was about. She said, oh, LSD. I said, well, actually, I was asking about the school bus. I was more interested at 10 years old in the school bus than I was in LSD. Oddly enough, my second LSD experience was with the noted Stan on the right. You've heard about Stan's breath work. You'll hear about Stan toward the end of my talk. This is me, still with a big round face, very recognizable. And this is my dad,